What's up, everybody? Dr. Rossi, board certified psychiatrist. I've been out for a minute, but I'm back. I'm gonna start cutting some more videos on a regular basis. Took a little time off, enjoyed myself a little bit, did a little vacationing, and now I'm back to bring you some more interesting and helpful mental health content. So before I do, I want to say thank you to all you guys who have liked or subscribed to the channel, especially my subscribers. I think we have an awesome community. I think everybody's been super friendly, super open, and really has helped me to grow as a physician as well. So I can't thank you guys enough for all the love and support. And anyone who's new to the channel, who's watching us for the first time, I would definitely suggest you subscribe because I'm constantly posting new content and I'm constantly trying to engage as much as I can, although lately it's been a little lax. However, today's topic is going to be a good one. And there's this common misconception in psychiatry, and it goes on and on and on. And it goes something like this. Never prescribe Bupropion or Wellbutrin to a person with depression who is also anxious, because it's going to worsen their anxiety. Now, what I say is nobody ever stops to question where this myth comes from. They don't even think about, like, why is it that we worry about worsening anxiety with bupropion? And what is the actual evidence in the literature to support this theory that gets talked about all the time in residency training, in attending life as a psychiatrist? It's a common misconception that's been tossed around all the time. So that's what we're here today to work on, is to understand why bupropion does not worsen anxiety, and maybe also which anxiety disorders you might want to avoid it in, because there's two very specific ones that some studies have said it does. But you're going to have to learn more about that in the next sections. So that's the topic of today's video, is bupropion and anxiety. Does it really make it worse? Before I jump into discussing bupropion and anxiety, I want to first explain why bupropion is a first-line option for me in the treatment of depression, even with people who have comorbid anxiety disorders, specifically GAD, or generalized anxiety disorder. So if you mentioned sexual dysfunction, then you're on the right track. And you already know everything that I'm about to tell you, because sexual dysfunction is one of the most common reasons that patients stop medication treatment for depression. And lo and behold, we have this medication bupropion, which has a very low risk, if really, I guess it's a minimal risk. There's still a little bit of risk, but it's much lower than the SSRIs and SNRI medications like venlafaxine. So this remains a good option for anybody who does not want to experience sexual dysfunction. Now, most of us, of course, don't want to experience sexual dysfunction as a result of our medications, unless you're a premature ejaculator. In which case, if you suffer from premature ejaculation, believe it or not, the SSRIs can enhance your sexual experience. A little known fact that most people overlook. But there is one benefit to the sexual dysfunction associated with SSRIs, and that would be for people with premature ejaculation. But I'm off the topic here. I should go back to bupropion. Some other reasons why I like it is, number one, it's convenient. It comes in an extended release formulation that can be taken once a day. Again, it's not too complicated to take one medication a day. It does become complicated to take a medication 2, 3, or 4 times per day, and often people forget to take their medication in those cases. So it's convenient. That's another reason I like it. And the third one is weight gain. Another common reason for people to stop their depression treatment is because they're gaining weight. And nobody likes to gain weight, just like nobody likes to have sexual dysfunction when they're taking medication. So this is another good reason to consider bupropion as a first-line option. Now, one of the reasons why people sometimes will tell you, I don't want to take this, or I'm worried about taking it, is because they're concerned about the risk for seizure. And they hear all the time that bupropion causes seizures. Oh my God, gotta watch out, right? Okay, well, yes, that is true in very high doses. If you abuse the medication, if you crush it up or open the capsules and snort them up, then you are going to have a risk for a seizure. However, most people who are taking the medication appropriately in doses up to 300 milligrams per day have a 0.1% chance of having a seizure. 0.1, not 1%, 0.1. And that is actually lower or as low as other SSRIs and SNRI medications. So that's one of the reasons, and these are a bunch of the reasons why I like this medication first line and why I'm not so concerned about the risk of seizure. All right, guys, so the moment you've been waiting for, bupropion and anxiety, what do we know? So one thing we know for sure is that bupropion is equally effective to the SSRIs and tricyclic antidepressants when it comes to the treatment of depression. Now, it gets put in this second line category because people have many concerns, one of which is seizure threshold, which we talked about. The other one that I will mention here is because people think it causes more anxiety or activating symptoms. Sometimes people will say things like bupropion is more activating, whatever that means, right? So what they're really talking about is activating side effects like insomnia, for example. So it could give you more energy and you feel more energized, less tired. You're not exactly going to sleep at night, right? That's not really the way it works, of course, but this is the myth that gets thrown around. So people are very concerned about the risk of bupropion and increased anxiety. But what does the research really tell us? Well, we're going to go through 3 or 4 trials here that I'm going to kind of point out, and I'm going to show you why this doesn't make any sense. So what we do know is that bupropion produces equal improvement in people with comorbid anxiety symptoms and has the same amount of activating side effects such as insomnia as the SSRIs. So just for your information, guys, this does not cause more activating symptoms or problems than the SSRIs. It's the same. Now, we can also look to the STAR-D. Now, the STAR-D, the world famous STAR-D trial, the one everyone talks about. Well, here we go. STAR-D tells us that augmenting citalopram with bupropion versus buspirone or buspar. So we got bupropion or Wellbutrin, we got buspar on the other hand. Which one wins? Well, according to STAR-D, bupropion wins. And not only does it win, it's significantly better than buspar for patients with anxiety. So again, the STAR-D is telling us that bupropion seems to be a reasonable option for people with anxiety disorders comorbid with their depression. So that's our next line of evidence that we can present here. Now, finally, there was one trial that actually compared bupropion head-to-head with escitalopram. So escitalopram is another go-to medication for depression treatment. I do consider it one of my first-line options if an SSRI is indicated. So escitalopram versus bupropion, what ended up happening? Well, bupropion kicked its butt again. So bupropion ended up demonstrating superiority over escitalopram in those with generalized anxiety disorder. So when they compared escitalopram and bupropion for generalized anxiety disorder, bupropion won. So that is another line of evidence indicating that this is a reasonable option for the treatment of patients with comorbid anxiety disorders or possibly just generalized anxiety disorder if that is the only diagnosis a patient has. Before I tell you guys my final thoughts, I want to tell you where this idea that bupropion worsens anxiety comes from. So this actually comes from early studies that indicated that bupropion might worsen certain types of anxiety disorders. Specifically, these were social anxiety disorder and panic disorder. But largely what we've seen in recent studies and as more data became available was that actually bupropion might be good at treating social anxiety disorder and might be good at treating panic disorder as well. So even those original anxiety disorders that developed this whole myth around them that got extrapolated to other anxiety disorders for bupropion don't seem to really play out in the literature and the evidence. So at the end of the day, I don't really think it's a major concern if somebody has comorbid panic disorder or social anxiety disorder and say depression, and you want to use bupropion because of its favorable side effect profile, it would still remain a reasonable option despite the early literature indicating that it may worsen those disorders. Okay guys, so let's wrap it up here because I've been trying to keep these videos shorter for you. I like to talk, I have a lot to say about psychiatry, but I should stop talking once in a while. So anyway, let's kind of wrap this thing up. Number one, bupropion should be considered a first-line option for the treatment of major depressive disorder because it's equally effective to both SSRIs and also the TCAs. And with that being said, it has one of the most favorable side effect profile. Again, limited opportunity for weight gain, limited risk of sexual dysfunction, and it's also available in once daily dosing, extended release formulation, so that makes it convenient and easy, and it's cheap because it's a generic medication that is available at a relatively low price, which is really helpful when it comes to saving money, right? So we know that this is a good option. We've also been able to demonstrate why this medication is not going to increase your risk for anxiety or make your anxiety symptoms worse. We've proven that through the literature review we've shown here. And we also know that this medication might actually be beneficial in the original anxiety disorders, namely panic disorder and social anxiety disorder, that people thought bupropion would initially worsen. So that's been largely dispelled as well. Now, there's two things that I would like to say at the end here. One is that we should probably avoid this medication in two scenarios. Number one, if you have a patient with an eating disorder like anorexia, where they are at risk for electrolyte abnormalities and potentially a seizure, you would want to avoid this medication. And you would also want to avoid this in somebody with epilepsy, for example, or a pre-existing seizure disorder, because you just don't want to run the risk, even though, again, it's 0.1% at doses under 300 milligrams and under. So I'm going to hold the video there. If you guys have not subscribed to the channel and you like the content, please give us a like and please give us a subscribe, because it really helps me to keep doing this and to know that it's valuable to you, when I'm doing busy clinical practice. So thanks again for watching, and please drop your comments in the comment section below, and I will try to get to them as soon as I can. Thanks again, guys.